Good afternoon, everyone. Welcome back to #CArthritis here at the Canadian Rheumatology Association and Arthritis Health Professions Association annual scientific meeting. It's been such a great meeting so far. We've been able to meet with so many of your colleagues. Dr. Bartlett, thank you so much for coming in. This is Dr. Susan Bartlett. Susan is one of a precious few PhD clinical psychologists in the world who both practice and do research in the area of rheumatoid arthritis. So as a person who's been surviving that diagnosis for the last 31 years, very grateful for your work, your time, and super look forward to talking to you about some of the work that I know you're presenting a lot of work over the scope of this conference. But today you're focusing on some poster presentations that really look at fatigue in rheumatoid arthritis.
We are.
And so thank you for this. It is a topic, as you well know, that people like me are desperate to hear about and learn more. Like it's the fatigue issue, as you well know, is so omnipresent in our disease. Yet, I know we're going to hear from you, not enough is known about it. So I'm going to just invite you to tell us about some of the work that you're presenting today at this meeting.
Well, thank you, Cheryl.
Yeah.
I will point out it's a little bit ironic that we're getting towards the end of the CRA. It's been 3 days. We're both feeling a little fatigued. And now we're going to talk.
Now we're going to talk about fatigue. Well, so we're well positioned.
We are.
We know the topic well.
We're feeling it well.
Yeah, we're feeling it well, yeah.
I also want to acknowledge that, you give an awful lot of credit to us, but truly, I can say without question all of the things that I've learned that are really important and all of the resources that I share essentially come from people like you. Yeah. A lot of it comes from you, but the ideas for research come from you, but come from people who live with rheumatoid arthritis and then tell us what they figured out. It's not like we as experts figure out what could be helpful. You guys have been on the ground, living with it, dealing with it. You figured out what works and what doesn't work, and I just try to put the ideas together.
Well, thank you for passing along the credit. I think what it shows is that in the field of rheumatology research, and particularly from yourself and others like you, Susan, you really see the value of the partnership, not just with organizations working on behalf of people with rheumatoid arthritis, but individual patients living with rheumatoid arthritis. Unless they sign up for your studies, you're not learning a whole lot. So it's this beautiful relationship, so thank you.
Well, and actually fatigue is the poster child for this because it was at OMERAC meetings maybe 20 years ago or so that patients started to come to those meetings, and when they were asked, what do you think about the work that we're doing and what do you think about the outcomes we're focusing on, they said, excuse me, you seem to have forgotten one of the most important ones here. Pain is important, physical function is important, but how come nobody's talking about fatigue? How come nobody's working on this area?
Yeah.
And it is still a bit of a challenge in some cases to get clinicians focusing on fatigue.
Why is that?
Well, because I think it is that we don't have great treatments. I mean, if you have pain, we know what we can do to help your pain right away.
Yeah.
It's much less clear with fatigue. Although that said, I will say, you've got, and you know this better than anyone, you've got to be active.
Yeah.
If you sit waiting for the energy to come, it never happens. You've got to move, you've got to keep moving. It is in moving that the energy comes.
So what aspects of fatigue in the work that you're presenting today have you looked at, Susan?
Well, so about 85% of people who are diagnosed will say that the first thing that they noticed was this profound fatigue, this just whole body fatigue.
Yeah.
For a substantial number of people, fatigue remains a problem as long as they're living with rheumatoid arthritis.
Even after they're on therapy?
Even after they're on therapy. In fact, you can get everything else to resolve, and fatigue can still be a problem to varying degrees.
Yeah.
Certainly one of the things that we learned in our flare work is the first signal for most people that a flare may be coming
is fatigue.
Is this fatigue. All of a sudden they're just overwhelmed with fatigue.
Yeah.
So very, very important marker, but we don't have a lot of explanations. You would think that it's tied to inflammation, and it is. If your inflammation is high, there's no way that you're not feeling a lot of fatigue.
Right.
But there are many people in remission who still have very high levels of fatigue. So why is this happening? Sometimes it's because something else is going on. They're really stressed.
Yeah.
They're depressed. They're very anxious. But that only explains a portion of
Right.
fatigue in people.
Right.
So there's this unresolved fatigue. And so we wanted to look at it much more carefully. We used the data from CATCH, the Canadian Early Arthritis
Which is a
Cohort.
gold mine. Thank goodness we have CATCH.
We do, because
Yeah.
we have more than 2,000 people now. We can go back and we look at them at the time, around the time of diagnosis.
Yeah.
And what we saw was that 70% had severe fatigue.
Wow.
So, well, their disease activity is high, they're coming
Yeah.
in, they're getting diagnosed.
Yeah.
70% report this severe, overwhelming fatigue.
Yeah.
1 year later, after they've received treatment, we wanted to see, we know about 30 to 40% will be in remission, actually even higher than that at this point.
Because of advanced therapies of today.
Because
Yeah.
the great treatment they're getting and the medications
Right.
that work better than ever.
Right.
And yet 30% of the patients who get into remission will still report this very high.
Which is high. It's above a quarter of the people.
Yes,
Yeah.
yes, it's
Yeah.
this persistent fatigue. So
Yeah.
we wanted to understand, are there factors that help us identify people who may be at risk for this persistent fatigue? Because when you have fatigue, you have more pain, you have more difficulty doing all of the things that you need to do every day, and you're miserable.
Yeah.
I mean, when you ask patients, well, let me ask you, what is the most problematic and troubling symptom for you?
I think because I have long-standing RA, it's limitations and like kind of daily aggravations because of loss of range of motion, joint degradation that's happened kind of over time. Fatigue remains, clearly, still over this long a period of time, and I have well-controlled RA.
And you're active.
And I'm active, so I'm doing all the things that you guys are telling us to do, yet I still have this sort of pervasive fatigue at periods during the day. And for me, I'm a bit of a type A, so I don't listen as carefully to my body as perhaps I should. So, it's that old don't do as I do as I say, is kind of complex. So I'd say it's, taking on too much, having to devote too much energy over too long a period of time. And, I'm not getting any younger, and I need to build in greater recovery periods for myself. You do. That's how I'm dealing with it. But I'm probably like everyone else listening to this interview, Susan. I'd like to kind of drive a stake in the heart of it and know the answer and know the perfect solution. There isn't yet one.
Well, I think that you have hit as close to a perfect solution as
Okay.
there is. You really have to be aware of patterns. You have to recognize that once you go past your limits,
Yeah.
it is going to be much harder. It's going to take much longer to recover.
Yeah.
So you've got to be proactive about it.
Yeah.
The one factor we did find, Cheryl, that made a huge difference, that really was the most robust predictor of who was going to have this ongoing fatigue, was weight and excess weight.
Okay.
And I say that fully understanding that when you have rheumatoid arthritis, it is much easier to gain weight. That drugs are, in some people, can
Can
really
be problematic, yeah.
to weight gain. It takes a lot of energy. It takes mental energy and it takes physical energy to lose weight.
Yeah.
We know that 1/3 of Canadians are overweight and about 25% are obese.
Yeah.
So we're not...
So in there is going to live RA in that population.
Right, and,
Yeah.
and body composition alters with RA. So
Sure.
it seems that with a systemic inflammatory disease, it's even easier to put the weight on.
Yeah.
Nevertheless, it's so clear that there is such an important relationship between not only disease activity and weight, but also fatigue and weight.
Yeah. It's really, that's fascinating. And it's hard without having RA, as you've said, to try to get back to your optimal weight or ideal weight. But you point out the importance of doing everything you can in the setting of rheumatoid arthritis to try to do that. It's so hard, in the work that we do as a patient organization, Susan, to say to someone who's in pain, who has lost range of motion, to get up and move, to get up and exercise. But we know, not only from your great work and the data that lives within your work on fatigue, but also in physical activity, that even high-intensity physical activity does not exacerbate disease.
Absolutely.
And that it's critical. So now you're knitting together the importance in a really critical way, because people are asking us all the time, how do I deal with my fatigue? And the answer is in many ways the same, but particularly in this population of people who are carrying just too many pounds.
So what I like to say to the people that I work with is that, maintaining a healthy body weight is important for everyone. For people with RA, it's absolutely essential. Because it just makes the disease much more active. It makes our drugs much less effective, it turns out. Yes. And if you put excess weight and smoking together, the likelihood of your ever reaching even moderate disease activity is so much lower.
Really?
Yes.
Wow.
So, when people say, what can I do? What can I do? I know this is one of the hardest things to possibly do. But losing weight actually really does make a huge difference.
So what are some of the pearls then that you give your patients that you've teased out of your research and you've actually turned around, Susan, and implemented them into your clinical practice?
That's a really tough question.
I know it is. I'm sorry. But you're super smart. I know you're going to give us a great answer.
Well, I started working as a psychologist, as a clinical psychologist, around weight and weight management.
I didn't know that.
And it turns out that all of the things that we were telling people, they were good strategies. Watch how much fat you're eating. You can't eat without paying attention to what you're eating.
Right.
All of those strategies are good, but we put a lot of emphasis on the macronutrient intake, so how much carbohydrate versus fat versus protein.
Right.
And we were probably pretty much off base. If you heard Dr. Spector's...
I did, on the microbiome.
So, all of this research has come out in the last 5 to 7 years. We didn't think about the microbiome 15 years ago, 10 years ago. It has a profound impact. So we're kind of between and betwixt all of the common sense information that we've been telling people about how to lose weight. Well, that's probably the reason why it hasn't been terribly effective, and people have continued to gain weight because we've had the emphasis in the wrong spots.
Okay. So when someone comes to us now as a patient organization about, we're going to go to Dr. Spector for sure, and get us some more information on this, because I know this will probably explode on our feed now, is microbiome. What is it? If what we were doing 5-10 years ago wasn't the right advice, what should we do?
So first and foremost, and I don't get anything from doing this, I would suggest you get a copy of his book, The Diet Myth. Because it was a New York Times bestseller. It talks about, now it's a couple of years old, but it still is the best source of kind of up-to-date information about the microbiome, what's known. He has a new book coming out, I understand. But it's really easy to read, and it's enjoyable to read, and it's really enlightening. So that's one place to start. Here at the CRA meeting the other night, what he talked about was probably the most important thing is to eat a variety of, he calls them plants.
Like 30 different ones in a week.
30 ones a week.
So start counting, people, make a list of what you're eating.
And in fact, it's not, they have looked at whether it's, a vegan diet versus a vegetarian makes a difference. The biggest difference is the number of different
variety.
Yes. And he reminded us that seeds and nuts and all of those things count as plants.
Right.
But it's variety.
Oh, good. I like that.
And cheese.
Thank goodness.
Apparently, cheese is...
thank goodness. I couldn't live without cheese, people. Well, that is fascinating. So, ideal body weight, or as close to it as you can get, has a profound effect on fatigue. That's a big message.
Let me just reshape that a little bit.
Okay, perfect.
Every bit of weight that you can get off helps.
Okay.
You don't have to get back to your ideal
That's why I said as close to your ideal body weight.
Okay. I'll even say lose 5 pounds. And in studies that we did, people losing as little as 5 pounds felt different. They sleep different right away. They feel better. They have more energy. So it all counts. Don't become overwhelmed by the task.
I think people have over time, and because of pressure from media, mainstream media, the ideal body and all that stuff. Hey, the ideal body is your body. That's how I think of it.
I like that.
And it's your temple. And your diet is what you put in your mouth that fuels your body, that gives your body health. Like, that's how I think about it. And my weight has gone up and down, and I know I have suffered early in my disease from deconditioning and some of the things that happened to us. And I kept telling myself to go to the gym, to keep crawling over onto that stationary bicycle, and even if you can only do 5 minutes, do 5 minutes.
Yes.
Do 5 minutes. And
You never regret it.
you never
regret it.
always feel good.
Yes.
5 minutes turns to 7, 7 minutes turns to 10. Then you look over at, the sort of weight machine where you can take joints through range of motion. You go, okay, maybe I'll try that. And slowly but surely you begin to incorporate some of these very healthy things into your life. And you can see change in your disease status. So super positive message from you, Susan. I know you've got like a wealth of stuff up there. Without hurting you, we'd like to crack your cranium open and really examine everything. And we know you have to go off to another meeting, and your annual general meeting for the Arthritis Health Professions Association, which you've been helping to lead for so long now. We want to thank you for your enduring support of the work that we do. We are doing the ABN booth and the #CArthritis initiative with Arthritis Research Canada and Arthritis Patient Advisory Board and the Canadian Spondylitis Association. So on behalf of them and arthritis consumer experts, we really want to thank you for bringing your wisdom into our interview booth. We want you to come back next year because we'll be here. And I think we need to schedule you for your 2 or 3 interviews because you have too much good work to talk about. But the fatigue piece, we really wanted to touch on that. I know if ever so briefly, this piece and these data that you've shared with us from your work presented at this meeting will be invaluable to our viewers and followers. And we're just going to turn to our executive producer, Anita, and see if we have any burning questions before we let you run off to your next commitment.
Okay, so the first question is there a link between IgG levels, infections, and fatigue?
Well, there absolutely is. So when your disease activity is high, I think I mentioned this before, you're going to feel overwhelmed by fatigue. That's just natural. That's because of all the cytokines racing through your body. That's actually your body's defense because it wants you to slow down and pay attention. And you need to be taking care of yourself. I always have this sense that our bodies are really so much smarter than we are. Because if you're not going to
for me, for sure.
your body is going to stop you. But on the other hand, we measure a handful of different compounds in the body, and we make all kinds of inferences about that. There's probably hundreds more we're not measuring yet that are really important as well. So there's a relationship. It's not as tight as maybe some people would like it to be, but it's this unexplained fatigue in people that are otherwise looking like they're in remission that is really of interest.
And can patients feel fatigue even when their other symptoms, such as joint pain, are generally well controlled?
Absolutely. We find when you look at people who are in remission, and that is a substantial number of people in the CATCH cohort, you have people with very low levels of fatigue, which is what you would expect, and you have people with very high levels of fatigue, and absolutely everywhere in between.
And
go ahead.
Requesting a quick summary, what is the microbiome? Someone wants to ask.
Oh, that's a very...
Go for it.
To be able to say it quickly and elegantly, it is the bacteria in our gut. We apparently have hundreds of thousands of different types of bacteria that are living in our gut. We come into this world with them, and everything that we put into our mouth, including the medications that we take, and the foods that we eat, alter the microbiome really almost on an hourly basis.
Wow. It's fascinating to think that.
Isn't it?
I think about a piece of velvet, and you run your hand over and it changes the pattern and the glow, and I think that's kind of, to me, that's what happens. That's the picture I have in my own head when I put something in my mouth. I just know everything's kind of going, what am I going to do with that? How am I going to deal with that? And so we need to be tuned in to the microbiome. I think that's what we're saying and what we've heard at this meeting.
And diversity is the key. You want it as diverse as possible. You can only have that diversity when you're eating diverse sources of plants.
So folks, variety is the spice of life. There's a reason that old saying was developed. Any other questions, Anita?
Last question is for Cheryl.
Oh.
For patients who wants to start exercising, what's a good motivation to help them start?
Well, I always start with this love concept. I think you have to love yourself. I think you have to find a place where you say to yourself, no matter what your body is feeling like or looks like, love it first. And that brings a wellspring of self-support. I think that's super important. And then I would actually reach out. There are great information resources with arthritis consumer experts, with this Canadian, like our partners in this endeavor, this #CArthritis project, have great resources, which you'll see in the feed here for this. And I would say if you haven't been exercising for a long time, start slow, because the worst thing you can do for yourself sometimes is to using our microbiome and what you eat. If you bite off more than you could chew, you get discouraged, and so that I think is an important message. And then lastly, I would say celebrate your exercise victories. I think we do not enough around self-congratulation, and that self-congratulation, it's a wonderful cycle. It turns into more self-love. You feel empowered, you have confidence. Buddying up with someone else who's going through your experience and going on that journey with another person is good, or several people. And you don't have to join an exclusive private club. You don't have to be a member of a gym.
You don't have to wear Lycra.
You don't have to wear Lycra. You have to have good shoes.
Yes.
You have to practice good joint protection, I think is really key. And you have to get out there and start doing. Start walking, start moving. Start doing simple knee bends at home, like the sit-to-stand test is a great thing to do at home. So come back to us, to our websites, and if you have more questions about specific exercise, we can get them answered.
And I would like to come back and talk with you about our yoga study.
Okay, there you have it. She's already invited herself back. I love it. So thank you, everyone, for joining us. Susan, thank you again. You're just this beacon of shining knowledge and also hope for us. We really love the topics you bring into our studio and your terrific kindness towards our patient community. Thank you.
Thank you.
Yeah.